Very good morning. Assalamualaikum warahmatullahi wabarakatuh. Welcome to our session again, Gibran Method, Gibran Visual Art Therapy. We are in another session with experts for this particular program under developing your unique potential. The Gibran Method brought together by myinsani.com under the sponsorship of Digital Malaysia under the Telecom Malaysia Group. And all this while, we've been listening to a few experts in the field, particularly with special children. And we have today with us Dr. So Joanne, a senior lecturer from the Department of Psychiatry, University of Technology Mara, UiTM Malaysia. How are you, Dr. So?
I'm good. Thank you so much, Mr. Rahmat, for the introduction and invitation.
Appreciate your being with us this Monday morning, glorious Monday morning, Monday 26 April 2021. Yeah. We will be streaming live into the Facebook pages of Gibran Visual Art Therapy, My Insani, and a few other channels that will be organized by our sponsor and our organizer. We also thank you, all the team behind the scene who's been making this possible. We hope to be of great as much potential help or assistance or benefits for most of our viewers and listeners, as well as readers out there in the social media channels. Now, with the specific topic on the paradox of stigma and mental illness, I think these are obviously a kind of very specific field of discipline that needs to be looked at carefully. And I think we are fortunate that amongst the group of parents and children that has been a supporter and also students of Gibran Method, we have a very committed group of people who wish to see that their children develop their full potentials within the limitation that they have. Now, with that note, we will start with getting to know Dr. Saw first, and you know who she is and what she does. With that, I'd like to invite Dr. Saw to introduce yourself first and how you are involved in this profession. How is your interest tally with the way where you see your career now and maybe your life as a whole? Maybe a good personal introduction from Dr. Saw. May I invite Dr. Saw, please? Thank you.
Thank you so much, Mr. Rahmat. Very good morning, to all viewers and everyone watching the live right now. I'm Joanne, I'm senior lecturer as well as a clinical psychologist from the Department of Psychiatry, University of Technology Mara, from the Faculty of Medicine. So I actually handle both. I'm the academician as well as I'm also the clinician, practicing clinician. And thank you so much for the invitation once again. It's definitely, I feel wonderful to be able to be on screen today and to share some sort of what I wanted to share the most with everyone out there as to the stigma, as well as to how are we actually looking into mental illness? How are we actually viewing well-being as a whole? Not only from the field, but I think everyone from the community, each and every individual should be aware or probably play their own role in terms of this when we talk about this topic per se. So I did my bachelor, master's, and a PhD, everything in psychology, later on majoring in clinical psychology, and my PhD revolves around adolescence, on looking into transporting, a clinically based cognitive behavior therapy into a school-based therapy, because I think it is time for us to actually bring this therapy, which is actually being used clinically, but it can be used by different profession and conducted by different layer of professions in a community level. And I think it's time for us to bring it to the school level so that we could create awareness. We could also assist those school children who is actually in need of certain therapy, understanding, as well as, tips and techniques on how to handle their depressive symptoms, anxiety symptoms, stress level, yeah, or any interpersonal relationship. Yeah. So I think it is really important that we start to, gather all this and put it into the community. So this was one of the my project, yeah, during my
Yeah.
PhD. And I personally looked very much into adolescents, as well as in general well-being of adolescents and each and every different layers of the individuals.
Okay.
Yeah,
Thank you,
that's
Dr. So.
briefly a
That's
little bit of my introduction. Yeah.
I'm sure there's a lot more that is to that, because I think in this field is so multi-layered, and like rightly so said,
Yes.
the kind of or method or the therapy that we are looking at needs to be executed by so many different members or different fields or different expertise to put it together in a what
True.
you call a school environment, or in a more community-based approach. Interesting. I think we've spoken a little bit about those in the past with various other experts, and to bring this into a communal or the community well-being, and also impacting, maybe something you can touch later on, that the community themselves have a big role to play in towards this, not just how teachers or in this case the schools is dealing with it, but also the response from the community at large to ensure the success of this particular process. Yeah,
Definitely.
again, yeah, it's you touch on a particularly sort of, for some, they might not know this. This is another part of this program that we do, is to allow opportunities to make aware that in the wider society there are children with this sort of learning disabilities, with this illness, with this kind of difficulties that needs to be what do you call it? They have to have the sense of empathy to them. So to understand that, they need to be more exposed to the field expertise that you, for example, in your field, yes, in your psychology and related fields. Maybe by this is, I think, where ourselves in Gibran and the team that we have, they're trying to put this forth as much as possible, engagement with the community at large. Of course, currently we are speaking to the converted. For those who came to the center, they are already sort of parents who are aware they need to do this, but we need to have more outreach in the community. I think that sort of maybe link up to what you're doing, and especially you are also established yourself in a public institution, and maybe this is one of the ways to get you out and trying to tell people, hey, you got Dr. Saw here, you can do this and this and that, and we hope you can be will be of value to you in that sense, trying to bridge or sort of experts who are usually fairly, I'm sure you're fairly much laden with all your own so much work to do, but then the idea is to give you more work so that more people will can reach out to the experts. Sorry, I'm blabber a bit on that part.
Yes.
I think, yeah, appreciate that you are being here today with us, Doctor, and I'm sure you have your specific topic that you are covering here under the paradox of stigma and also mental illness, and you have a presentation. Let me know when you're ready to do that, and I'll let you to introduce the topic for today. Please do so.
Sure, Mr. Rahmat. By all means, probably, without any delay, maybe we could just put up the PowerPoint slides, and I could briefly run through with everyone.
Okay.
Great. Thank you so much. So, of course, definitely, I was asked to actually to come up with a topic, and I think that it is time for us to actually look into stigma and mental illness. Despite actions has been taken, different form of help as well as awareness has been there, but we need to be clear that stigma will be one of the contributing factors to the reaching out, or reaching out as well as seeking for help in Malaysia. Okay, not to extend to worldwide, but let us look into our own local context and see how could we actually break through this barrier and ease the whole seeking help as well as understanding mental illness among us. Yeah. So, Mr. Rahmat, could you just go to the next slide?
Sure.
So, before we go any further, probably what do we understand by the word stigma? Yeah, it is actually from the Greek word, actually stigmata, yeah, which is actually a mark of shame or discredit. Yeah, is actually a stain. Okay, we are actually identifying a certain characteristic with a stain. Yeah, you see the definition itself, it is so stigmatizing. Yeah, because it is an act of identifying, labeling, or attributing undesirable qualities targeted towards those who are perceived as being shamefully different, yeah, from the social ideal. So this is what we say stigma. And when there is an act of stigma, there will be discrimination, which is also an act or treatment based on the stigma and directed towards the stigmatized. Okay, so we can't run away stigma and discrimination, which is happening not only on mental illness, yeah, but on any other variables or any other aspects, yeah. So, but now, of course, we are focusing on mental illness. So, stigma, when it is used in reference to mental illness, it is actually multifaceted, yeah. It comes with feelings, attitudes, behavior. These few constructs are there when we talk about stigma. Okay, so moving on next, just a very brief introduction. What is stigma actually? Yeah. So it will be next. Okay, and when we talk about labeling, labeling are meant for clothes and everything. It's meant for any other objects, but not for people. We don't label people. We are the same, yeah, regardless, yeah. So we don't label, yeah, for people. Okay, and how do we actually moving on? How do we actually stigmatize? How does it actually comes about? There's a 4-quadrant, yeah. Mr. Rahmat, next, yeah. So there's 4 cues when we look. How do we actually place a stigma? First, based on the psychiatric symptoms that you could see, yeah, or if you could put it in general, says what are the manifestation of symptoms that was presented. Okay, some we might see, uncam, talking to themselves, let's say, for some examples, or self-harm, or some sort of having delusion, grandiosity, or maybe we could see some children who are very aloof, keeping to themselves, unable to keep up to certain social interaction, having trouble reading words, yeah, having seen words jumping around, mirror image. All these are the symptoms that you could see. This is when people starts to stigmatize, yeah, or any social deficits. This particular individual unable to take care of themselves, can't even take shower, can't even perform certain action of going to the groceries, or unable to keep up with certain job. All these are the time when people start to stigmatize some other individual, or physical appearance, yeah, certain physical disability that you might observe from bare eyes, or probably the physical appearances, okay, or how they actually present themselves. That might be a form of stigma. And of course, there goes the labels which has been placed on them. Yeah. So maybe how could we actually look further into this 4-quadrant? Yeah. So maybe next slides. So what are the factors, as I've described earlier, yeah, the attributes that we have? Then we would say that in terms of gender, then we would say that, male are more predominant in terms of this, psychopath, or they are much more scarier, they are much more aggressive. These are the form that we actually have it from our society. Unknown sources, yeah, or the appearance, the behavior, something that they have been doing, okay, or they hurt themselves, or they're unable to express, big temper tantrum. All this is actually what we use to discriminate an individual, yeah, or homelessness. You see someone at the roadside, homeless, talking to themselves, okay, there goes your stigma. Yeah, or what other factors that we could have that influence discrimination? Yeah, would probably be the next slide. And these are how stigmatizer actually look into it. Yeah, so these are some of the example. Okay, so or probably they might perceive certain focus of the illness. Oh, they couldn't do this, they couldn't do that, they can't perform this, they are lacking in terms of this aspect. These are how we started to increase our prejudice. Okay, or certain admission to the hospital, then say, oh, okay, probably this person is seriously ill. Oh, he is a very sarcastic, a very, very bold remark would be, oh, okay, he's insane, he's crazy, he's admitted a few times. So these are those factors that could probably increase the prejudice, and it will actually stay rooted as a stigma for the stigmatizer. Yeah. So maybe the next slides. Let us have a look. The next slide. The next slide would be knowledge. This is very important. Yeah, how we actually increases the our prejudice. It's when we feel that, okay, this is beyond, can't be cured, or they need constant medication, or what, those who are having mental illness, they are very violent, they are very aggressive, they will actually cause danger. Yeah, so these all these kind of factors actually has been rooted and becomes a platform to go for stigmatization as well as prejudice to others. Yeah, they say, oh, okay, this is incurable, it's chronic, this will be forever. Again, this is already stigmatizing on its own. So how do the knowledge, and how do we perceive mental illness will actually increase our prejudice. And so where does the knowledge comes from? Probably unknown resources, probably the lack of awareness. Yeah. And the way you perceive might be negatively wrong. And that comes stigma. So we need to know where all this actually comes from. So we could see, what could we do actually? How could we actually try to debunk these misconceptions? Yeah. So maybe we'll move to the next slide. So let us just get a very, very brief idea of how is actually the mental health problems in Malaysia. Yeah. So survey has been conducted. Yeah. National Health and Morbidity Survey has been conducted over the years. Yeah. In Malaysia. So for adults, we could see that 1.7% actually have generalized anxiety disorder. 1.8%, which is actually equivalent to 0.3 million, actually has current depression, and not to mention suicidal ideation, or the attempt that they have, the attempt of a suicide attempt in the past. Yeah, so these are some of the breakdown to give us an idea how is our mental health, as an adult, and what happens to the adolescents and children. Maybe the next slides we could see that National Health and Morbidity Survey has also been conducted in 2015 as well as 2017. So how is the prevalence like of the mental health issue? So we could see again, back in the 2015, we could see individual over 16 years old and above actually contributed 29.2% as a total of prevalence of general mental health issues. And children below 50% actually stands of 12.1%. So if you could see, records are there. Yeah. Records are there. And also they narrowed down, in 2017 among the adolescents. They look into depression, anxiety, and stresses of our adolescents. And just take up one example, you could see how much it rose in terms of depression. 7.7% in 2012, and it rose to become 18.3% in 2017 survey. This is only by looking at depression per se among the adolescents. Yeah. So the figures, the statistics are quite alarming. And are we, how are we going to do and play our role? Not only to support, but as well as how are we going to make this into a better way for us to live together. Yeah. So these are just some of the statistics that I'd like to bring up. Yeah. As it is an alarming statistic in fact. Yeah. Okay. Then moving on next. So how is the stigma like on mental illness in Malaysia? Yeah. So maybe we might want to look a little bit, just very brief information, which will be in the next slides. Yeah. Mr. Rahmat. Yeah. In the next slide. So this is just studies conducted back then, yeah, where we still Asian cultures, we still look into witchcraft, or we still look into spirits. They are still this belief among by the which is believed by the majority of the mental disorders. Yeah. And of course in Malaysia, yeah, despite the changes and everything, we still have this strong stigmatization based on this study. We still have this. And of course, there are still some group of people who actually attributed mental illness to supernatural agents or possessions of spirits, yeah, which is regarded as a common causes of mental illness. I mean, there are still beliefs as such, yeah, but of course, in our multicultural perspective, we need to consider and we need to look into all these perspectives as well. Yeah, we need to respect this and getting it, combining scientific medical knowledge that we have and incorporating cultural elements as well, yeah, in our management or in our health. Yeah? So this is one of the study to just roughly know, we are still having this thought, this perception, but at the other end also, yeah, next slides. So we have the next slides would be, yeah, of course, yeah, in a study back in 2012, we also see that because mental illness were attributed to supernatural causes, so hence we did engage very much in traditional healers. Yeah, we do in a way, and hence there's a poorer compliance to medication. But of course, over the years, things might have changed. Yeah, but however, we need to take note that the belief needs to be acknowledged as so that it could actually help in the management. Yeah, because we believe that the cultural sensitivity must be there. Yeah, we need to because we are deeply influenced and rooted, yeah, with culture, religions, traditional backgrounds. So we need to acknowledge this. We need to consider this. But at the same time, how are we going to incorporate this into management? Yeah, of course, we are still, I would say, mental health services. We need to increase a little bit more. We need to intensify. We need to put it as a priority. Yeah, we did, but more needs to be done probably. Yeah, and higher self-stigma was observed. Yeah, in a study by Ibrahim, we could see that among adolescents, they actually have more high self-stigma. So when they actually have self-stigma among themselves, like, oh, I'm not normal, I'm not right. No one wants to be friends with me. I'm alone. I'm a weirdo. So it actually creates a barrier for them to seek for help. So this study targeted very specifically, we could see it is much higher as compared to other group. Yeah. So adolescents actually has a higher self-stigma in themselves. So with this, we know that this group actually, it's actually in the middle, the sandwich in the middle, where the transition itself, yeah, needs more, I would say, fragile in a way that self-stigma was so prevalent there. Yeah? So these are some of the studies that we have. Yeah, and also, what about our help-seeking tendency? Yeah, so you say 62.3%. I would rather not letting other people know. 61% would say that they are to be blamed, self-blame, yeah, self-attributed. And 51.7% actually still feels that mental illness are often dangerous. People having mental illness are violent. That is definitely a myth. And what not? 76.5% don't believe that anyone can suffer from mental health problems. This is how we say, it's okay, go for a good sleep, you'll be fine tomorrow. Or you are just being too free, you are thinking too much. This is the common things that we hear, which is like, nah, you are just thinking too much, you are just over analyzing it. Okay, you are just too free, you're not doing stuff, so you've been thinking a lot, dwelling into all this, and having said that, with depression and whatnot, so we actually could see from the research that it actually holds a very big percentage of how the Malaysian actually view mental health, as well as what about the help-seeking behavior. Yeah. So maybe we'll move to the next.
Yeah, Doctor, can I chip in a bit? This particular large percentage of people who don't believe that anyone can suffer from mental health problem, it's a very huge majority. It's a big figure to have. And I don't know about the sample size for this, but eventually, it shows that it's a sense of denial, isn't it? It's just like it's denying this is a problem that exists in the community.
Yeah, but of course, over the years, things might probably have changed a bit in a way. But we could attribute it to denial in a way. Yeah, that they are not accepting it. But there are also another perspective that I'm thinking of is the knowledge. To what extent that you are aware and you know that, this is something that needs to be taken action on. That, okay, this might be some sort of mental illness. It might be the knowledge, the exposure that we have, despite denial. Probably these two factors might be the greatest contribution, I think.
Okay. Thank you, Doctor. Sorry, carry on.
Yeah, of course, this will be, of course, the sample size, and then of course, as well as the, it was in 2009. But over the years, we will be expecting different statistics coming up. But it's just to point out that, wow, in one particular study, we could actually see as such. And it somehow tells us something. It might not be generalized, but it somehow tells us give us a little bit of idea. Yeah. So, and what are the impacts of stigma on individuals with mental illnesses? So, having said that, they begin to see themselves in negative light. Definitely. How all these external pressure, external factors, stigma coming on, they begin to see themselves in negative light. They will feel the lack of love or loneliness. And one of my, I remember, there are cases that, the patient feels so unaccepted. Yeah. This particular young gentleman just wanted to have friends, just wanted to merge with other friends, to play with other friends. But however, he was not accepted. He was not accepted to be in a group. And he was telling me, like, why these people do not want to be friends with me? Just because I'm weird? You see how they actually starts to proclaim themselves, like, is it because I'm weird? Because I'm different from them? It's a young gentleman, yeah? So it's so heartbreaking to hear this, that I just want to be friends with them. I just want to play with them. I don't want to be alone, yeah, in schools. So the feeling unaccepted, it's so agonizing, and it's so overwhelming, yeah? And to a certain extent, they will felt themselves as a burden. It's better off if they don't have me. I'm such a burden. This is so common that we hear from our patients. Yeah? And lack a life of their own. All will be planned. Okay, you do this. Okay, you go this, you do this treatment. Everything is being planned just because we felt that they can't have their own thoughts. They don't have their own vision. They can't actually move forward. So everything needs to be planned. Yeah. And of course, what not? Rejections. Yeah. They can't get it in any way. And it will keep on happening again and again and again because of stigma. Yeah. So maybe these are some of the impact in terms of individual. So besides that, this is what's happening to them. What about employment, let's say, yeah, which would be in the next slide. If Mr. Rahmat could go to the next slide. Yeah, it will be employment. Yeah. Okay, so of course this is just, I'm just going to go really quickly and really brave in a study where, of course, most of the schizophrenic patients are actually unemployed. Yeah, so we could see that it is quite of a difficulty for them to actually secure a professional job. Yeah, and mostly it will be a semi-skilled job. Yeah, that would be offered and would be able to be offered to them. Yeah, and those who manage to actually secure the employment, they actually fighting with stigma, discrimination. They actually fight, and they came to me and says that um my bosses asked me to check this particular report 3 times. I said, oh, why so? No, just because he says that I might overlook or I might be zoned off for a while and my information might be incorrect or my data might be wrong, and I'm asked to check 3 times at least to ensure that. So they are being doubted of their capabilities. Yeah. So definitely with other colleagues, they will be isolated in some way, yeah, or sometimes they might be experiencing some sort of medication side effects, let's say, or low confidence, they will be secluded even if they manage to secure employment. So they are, certain part of them that they need to fight against too, besides the stigma, yeah, of employment. Yeah. So then next, what about besides employment? What about you see, it's quite high actually, yeah, as compared to people with physical disability or other illnesses. So, but people with mental illnesses are actually having a higher employment rate, yeah, unemployment. But of course, having mentioned all this, over the years, we have also seen initiative has been done, which I'll talk about, later at the end of what have been done or what have been, we have been doing to address this issue. But of course, we do still see that, this might be a effect of stigma. And what about the access and the use of healthcare services, yeah, which we could see in the next slides. Yeah, so they are reluctant. Even in Europe, yeah, they are reluctant. Not because there's no clinical services in Europe. Yeah, it is well established, but it is the idea that if I were to step into this particular center, I'll be looked differently. Yeah, I still remember there are patients actually who ask, how would your clinic or your setting, how's the name like, and what's in that building? So can you see these questions as being posed? So is it been written pusat psychology, pusat psychiatry, or it will be written as well-being, or will they be different department under one building? This is how fearful it is for them to discriminate or label. Because the moment you step into this clinic, oh, okay, you actually falls into the mental illness, you are crazy, how people label, you are not well, So the worries that they have, all this checking has been done. Personally, I've actually seen patients like this who ask, how is the setting like? And of course, the misconception.
Okay.
Will I be cured? Yeah. So all this actually stigma really revolves around our community. It's happening. Yeah. So these are probably employment, access to the clinical services, and not to mention how it actually affects an individual. But what are we going to do next? Yeah, which we could see in the next slide. So again, you see, imagine if you got blamed for having cancer. Are you to be blamed for having cancer? Yeah, I think it is time for us to end the stigma as well, the discrimination of mental illness. And I actually took this from, and to bring a change, which I totally agree with. Yeah. So the next slide would see on how do we actually, you see, I actually put in special needs. We don't really put in like mental illnesses, or maybe they just might need some sort of assistance. Yeah. So why not we look into that, care and support to people with special needs? How do we actually establish, interact, and maintain appropriate relationship with people who have disabilities, mental illnesses? How do we actually establish that? Okay, so let's move on. First thing first, acceptance and non-judgmental. Yeah, and you see, Mr. Rahmat had highlighted the empathy. The empathy should be there. Yeah, so you see, acceptance would be, how do we actually talk to someone? How do we actually see someone? All our non-verbal interaction matters. You see, they are so sensitive that they know that you are looking at them differently. The way you see them or the way you talk to them differently. And we sometimes notice that, people like to talk in a baby talk, baby language to an adolescent, just because they have some sort of mental illnesses or disabilities. Then they start to say, oh, I have to treat this like a baby, and starts doing all this baby talk, which they don't. They could totally understand and respond appropriately. Yeah, we don't need to go to the level of doing all this baby talk. In fact, it's very frustrating. And we need to show certain respect that we have to them. Yeah, they knew what is happening, and they know how to handle it. And the utmost, above all, we need to show a certain level of respect and never talk down in a patronizing fashion. Yeah, we don't go overboard. I think it's better for us to be real, show our respect, try to stand from their perspective, knowing what can be done, what not, and how to go about it, rather than feeling superior and talking in a very patronizing fashion. And don't use labels or offensive terms. Sometimes we like to ask parents, so what is wrong with your child? This word itself, it's so hurtful.
Yeah.
What
I'd
is
like to
wrong
chip in
with
there,
your
Dr.
child?
Shaw. I like to chip in there. That's a common thing you can hear in a restaurant or in a public spaces. Oh, what has he got? Or what is this a special child, or someone? Is he sick, or you can see a child with maybe seemingly, because things like Down syndrome will be quite obvious in the physical sense. So obviously already, but you still have to ask and make it sort of as a big deal out of it. So it's again, like you put it, that is labeling. And I think the more I listen to you, the more I realize that it's a very commonplace scenario that we see around us now. I think that's to do with the lack of knowledge, like you put it, and maybe the lack of empathy, or maybe not so much they're not respecting, but because of the ignorance of how to address this particular situation.
True, I totally agree with you, Mr. Rahmat. So because all these are so overwhelming that I really wanted to take this opportunity to talk about it. Like, it is so offensive sometimes, and there are also incidences where people, they don't speak directly to the person.
Oh yeah.
They speak to the caregiver, or they speak to the aide, or they speak to anyone next to them or beside them, but not the person. In fact,
it's
you
like
could
ignoring
talk to him
them.
or her. Exactly.
Ignoring them.
You have put in that they could not respond to me, they couldn't tell me anything, no, they couldn't interact, might as well I just talk to the mother. Where is the respect? You talk to the caregiver, and you are not talking to the person, which they could react to you, they could respond to you, or you could build certain interaction over there. But you choose to ignore, no respect, and you talk to the caregiver. This is so heartbreaking in a way that they do not speak directly to the person. So what we could do is actually speak directly. And I'm sure along the way, the parents or the caregiver or anyone would actually chip in or provide more information. But we have provided the basis of respect as well as interaction to take place. Otherwise, we are actually forbidding it from happening. Yeah. So probably the next slides, we could talk a little bit more what else we could do to the very least, and stay calm and be supportive. Like what Mr. Rahmat, you said earlier, I think every single child actually will throw certain temper tantrums, let's say, in a shopping mall. Any child, yeah? Or there might be some incidences that might be happening. But I think we attribute it more when we see that, oh, when there's certain mental illnesses that you could observe when you start to stigmatize, you seems to be like, the more the merrier. You are putting in, comments, what's wrong, putting in all these remarks over there. Why don't we stay calm? Why don't we be supportive? I'm pretty sure the parents could handle the child and allow certain help to be done there. But don't. We like to intensify it. Merely standing and watching, being a bystander, or putting certain remarks. And with technology now, we take our phone, start video camera it, videotape it. So I don't think this is a way that we should do it.
Yeah.
Yeah. So, and we shouldn't allow this disability as an obstacle. Yeah. When I talk to parents or when I see caregivers or anyone, we should always look into what are the strengths that they actually have. We should look into their strength. Yeah, the child or the individual or the person's strength. Because I believe that every single individual would have their strength. Yeah, they will be good at something. Probably it's just a matter of time for parents to actually dig out what the child actually good at. Yeah, to start to know, oh, okay, my child probably like this, and she's very good in art, or she's very particular, or try to dig out the strength that the child has. And not keep on looking into the disability. She can't do this, he can't do this. And we forgot what the child actually able to do. Yeah? Or even among adults. We keep on focusing on the symptoms. But we've forgotten how well this person could actually has certain other skills that could contribute to others. Yeah? And when it comes to adolescents especially, I think we should give more attention in terms of listening to them, allowing them to participate in the decision making. They have their thoughts, they have their perception, they might have their goal that they want to achieve, probably needing some sort of guidance. Yeah? So maybe we should listen more to them. Yeah? And eliminating barriers, trying to fix. Seems like we just wanted to fix what is not right, what is not compatible, but we don't allow it to grow. Yeah? And of course, we don't judge and criticize. Simply enough. Don't judge and criticize if you're not sure of what is happening or what they have went through, or we are unsure what is this all about. So we don't judge in any way. Yeah? So these are some of the things that we could do as a community, as an individual, regardless of, any one of us. I think these few things that we could actually place our focus on. Yeah? So maybe let's move on to the next slide. Yeah, and of course, assistance and support changes through the life cycle. Yeah, because in childhood, probably some sort of support will be different than adulthood because we are more focusing on education, let's say nursery, But when it comes to adulthood, probably workplace, yeah, or support in terms of residential support. But when it comes to old age, yeah, people with certain mental illnesses, probably the support will be different, like nursing home, yeah, home help services for them. Yeah, so it changes along the lifestyle in terms of formal support. Yeah. Okay, moving on to the next slide. So what can be done and what has been done? Yeah. So we will see what can be done. In fact, simple enough. I think I just highlighted a few little points at in terms of what can be done. Yeah, awareness. I have to highlight that. I think we can get a lot of information. I think more exposure has been given. Even today's talk, yeah, I think Mr. Rahmat also highlighted that the idea of create the awareness, yeah, pass the message around, yeah, about mental illness. And we need to educate ourselves and others about mental illness, especially to our children. I think we need to start to actually educate our children to actually be aware what is mental health, what is mental illness, what is well-being, rather than they get it from unknown sources or they got it from a stigmatized community, a community that actually the stigmatizer, or any misleading information from media, let's say, unknown sources, unreliable sources. Children might learn all this. And this is how they actually react to their friends. Oh, okay, oh, he has autism and so on. So I'm not going to play with him. I think the children has been exposed in a wrong way. I think it is time for us to educate ourselves, equip ourselves with a little bit of more information, and of course our children. I think the younger children generation should be equipped with the right knowledge, the right information.
May I chip in there, Dr. So? I think that's
Yes, please, Mr. Rahmat.
it's a very salient point with making sure, it's probably a little bit too late with the older generations, but we may have a better stance in terms of educating the younger generation, children especially, to start to develop this awareness and empathy and the way how to deal with other friends who may not be, like, put it like them, so that avoiding stigmatization or stigmatizing among themselves. These are, I mean, growing up in certain communities, you might think about those children who were at your early age thought they were described as being very slow or maybe not sort of up to speed with everything, but not realizing they may have their own strength and what do you call it, advantages that we don't know about. And
Yes.
it's easier for us to, I mean, I recalling, our childhood back then, this where we might know them as maybe autistic or with the Asperger syndrome or other sort of special abilities or learning disabilities. And we, obviously you look at it back and goes, that's regretful. You're not actually doing something better. And hopefully we can get our children now, our future generations, to do better in this perspective, in trying to sort of get involved or being able to understand and appreciate that there are other children with different ways or learning, what you call it, learning disabilities or other form of disabilities or special characteristics that is associated with them, or mental illness. I mean, some it may not be illness. This nature is probably not an illness. I don't know. Maybe that's something you want to expound on. Just my observation.
I can't agree more with you, Mr. Rahmat, and echoing what you said, yeah. So mental illness should be looked as a continuum. Yeah. How alike instead of how different we are. Yeah. Maybe I can put it this way, as in we do have certain feelings, we do have certain emotion, we might be sad on certain days. So we should look at it as a continuum. Probably they might be at the other continuum, which is slightly more severe. So instead of how different we are trying to see how different we are. Why don't we look how alike we are in the continuum? It's just at a different stage, different continuum. Yeah. Instead of we keep on saying we are different. I think we should look into mental illness as a continuum and how alike are we instead of how different are we. Yeah, I think this is really important. Yeah. So echoing what Mr. Rahmat said, totally, I totally agree with you on your remark and also your opinion on that. Yeah. So let us just focus a little bit more on what's next on the slides. Yeah. On the next one. Okay, the acceptance of self and family members towards illness. Yeah, you see, stigma sometimes it doesn't only allocated to that particular individual. It's somehow extended to the rest of the family, which we call it as a courtesy stigma or associative stigma. So, your family actually has a child of this, or your husband is this. So it is associated and extended to the rest of the family. Yeah. So this is also one form of stigma which needs to be handled and managed as well. And you see, we are not helping. We are putting another step on them. We are not helping, yeah, but we add on your husband, your child, your family members. We are already not helping much, and we add in another steps ahead of it, yeah, which is, this is what we call courtesy stigma, associative stigma, yeah. Of course, yeah, family members, yeah, a part of course, there are certain feelings which might arose from that. They might also have a feeling of shame or guilt or self-blame. Yeah, I do have parents who actually comes and they blame themselves for, why am I holding this so late until now before I come for treatment? Why am I not realizing this earlier? Or why am I allowing, oh, it's normal, child, some of them will take up a little bit more time. So as, time given and given and given, so it dragged to like 7 years old, 8 years old, or 9 years old to detect some sort of help that might needed, yeah, for the child. So they are guilt, self-blame, and some might have shame before reaching the stage of acceptance. So can you see how much of the stages and how much they actually went through the journey from self-blame, guilt, shame, anger to acceptance? Yeah. But more often than not, I would actually share with parents like, let us actually move on. What's next? This is my keyword. What's next? What are we going to do? Or what is the next thing that is the best for the child? And let us move forward and see what's next. Of course, certain support needs to be done there, but of course, cut it short, it would be what's next. But we need to handle, yeah, the self-blame, guilt, and everything for the caregivers so that the journey could be smoother for them. Yeah, and of course, supportive relationship is very important because it will shape the individual's self-esteem. It will also help in recovery. It can actually help in more progress to be seen, yeah, which is in the next slide. We could see that with a more supportive family, yeah, in the next slide, with more acceptance, it is actually more effective, and we actually encourage more recovery. So as I said, what have been done, over the years, there are quite a number of initiatives. Yeah, nationwide structured family psychoeducation program has been ongoing, yeah, to educate, to equip, and as well as to assist, yeah, families or even individual, yeah, for treatment and etc. Yeah, and moving on to the next slides. So we have a few more slides, I think just a few more left, yeah. So the next one would be in terms of clinical services, as I said, yeah, there are we actually paid more attention to the diversity, yeah, of the self-experience, what is being experienced by each and everyone, yeah, and we actually encourage clients to separate the illness from the self, practice a survival attitude, yeah, differentiate, you as an individual, you have your skills, you have your strength, you're going to work on it. It's the same as, you are having headache, you are having, diabetes, you are having this, but you are still working, doing the best out of yourself. You are the survivor. Yeah. And of course, we like to incorporate social skills training, yeah, support group. It is an ongoing process. Yeah, as well as using internal and external resources, yeah, problem solving skills. Of course, we need to look into multi aspects or even time management, stress management. I think all this has been incorporated in clinical services that has been used to assist our anyone who's in need of it. Yeah, and next one would be, besides clinical services, as I shared earlier, it has to be go into the community, which is in the next slide. To go into the community, NGOs, yeah, and of course, employment, yeah. So this is very small. I just want to go really quickly because in terms of workforce, initiative has been done. JKM and our government has actually incorporated a lot of initiative in terms of pre-recruitment, recruitment, and post-recruitment for individual. So I'm just picking up one example, which is a Pusat Kesihatan Mental Masyarakat Mentari. Yeah, it's a new approach, yeah, initiated by the Ministry of Health Malaysia to improve outreach and reintegration of people with mental health problems. Yeah, so Mentari actually provide continuing treatment in a more accessible manner. Okay, they also actually provide lots of psychosocial intervention. They provide counseling, therapies, and psychoeducation, as well as screening for mental illness and promoting early treatment. And the fourth point was the wonderful one, to reduce stigma and discrimination. This is one of the objective as well, to hopefully with more awareness, psychoeducation, reaching out, it would be able to reduce stigma and discrimination. And very wonderful, they also provide work-based rehab and supported employment to prepare this individual to actually goes back to the community, to actually seek for job, for them to be independent, which is very important. Yeah, but I'm just picking up one, but there are many other, helps, NGOs, or government programs to assist the individual. Yeah, but of course, time constraint, I'm just picking up one. Yeah, and as I said, I think just one or two slides more, which is the next one, would be reorient the school, community, and NGO services. Of course, we are still focusing very much on physical health, but as I said again and again, over the years, things has been changed. And of course, we need to include more mental health component in school services, community, and NGO, which is one of my project early on. As I mentioned, my PhD project is to start to bring the evidence-based therapy into the school setting.
Yeah.
We want to provide more exposure. We want to go for early detection. We want to go for a more educational program in schools, and training the school counselors, teachers to be a part of it. That's say school.
Yeah.
But of course, community and NGO, we should also increase more mental health professionals in the setting, probably, to actually bring out the effect. Yeah. And of course, we can't run away from research, research and mental health. But of course, we are still lacking a bit. Yeah. But of course, we hope that we could actually put in and vacuum all the knowledge that we have to increase the literacy, to increase the awareness, to actually promote help-seeking behavior. We want to look into the quality of life, of people with mental illness, as well as the equality, of access. Of course, with stronger evidence, we need stronger evidence. We need more research, so that to advocate for better mental health services, so that we could actually promote more effective change in terms of stigma, in terms of mental health issue, as well as for the welfare of the community. Yeah, I think this would probably be my last slide, and I will end my presentation for today. Thank you so much.
Thank you very much. You browsed through that presentation like a train, moving fast. I think there's a lot of things to cover, indeed. And
yes, there's a lot that I wanted to share and talk.
Thank you for those very, very effective, and also I think very what do you call it, not eye-catching, just something that is bringing sort of these issues that actually has been there for a long time, and then bring it to prominence and make people realize we have to do better in all aspects, and especially as a community, we must enhance that awareness. Otherwise, we are doing injustice to our fellow family members and friends and neighbors, and without knowing that we are doing a lot of harm to the individuals, especially those with this specific mental illness, and an illness, and it can be cured. I think that's your point today. And it needs a whole, I recall this saying, like, it needs a village to raise a child. So we need to get the village to go back on track to help those with mental illness, learning disabilities, to be sort of to survive, or just to live their life in a more sort of harmonious way, I suppose. I think that's probably like everybody want to achieve happiness. And I like to probably highlight the one point about when you involve the family, when a person, a child, is having a mental health issues, and like as if the whole family have it. Maybe you like to sort of do a bit more examples of that, and how is it going to be? How does it gonna how are we going to help, or how does a family cope with that? What can they do as a family?
Okay, probably I'll just take one example. So okay, we have patient actually comes in, being probably go for assessment and with a diagnosis of specific learning disability, or probably any other diagnosis that we could name it, yeah. And how does it actually goes into a family? Yeah, we are not talking about stigma right now, but how do the family members could actually assist, or what could be done, if I got you correctly, Mr. Rahmat, yeah, as a family,
Yeah,
yeah.
as a family in that
Yeah.
situation.
So again, true. So of course, we need to discuss on what's next, as I usually said. What's next, as in what needs to be done, what can be done, and what will be done in a way that education-wise, or in terms of any other aspect that we could done. But
Yes.
of course, I like to talk to the parents, says the parents, yeah, father and mother. We always sit down and I encourage them to talk to each other. I encourage them to have a session between both of them to look into this matter regularly. It's not like one day or 2 day, but always to have a talk on keeping each other updates of the child, or
Yeah.
sharing how do I feel about my child, about our
Yeah.
child, or what
Yeah.
has happened, and how do I handle it? Because we need to align the parenting styles. Because
Okay.
sometimes we will talk about if you're having two very different parenting styles, it might create a confusion to the child. So they need to align it and get it sorted out behind the door, at the back of the door. And
Right.
it got to be presented as one, so that we do not create any form of confusion to the child.
All
Yeah.
right.
And I believe that husband and wife needs to really support each other. They need to have a support group. They form a support group on their own to talk about the matter. How are we going to look into it? And what are the things that we could do? Because sometimes you could see that only the one bringing the child to the clinic. Probably at
True.
night, the husband and the wife can talk about it. They need to have a continuous talk to support each other. Let's say either one actually fall, the other one can actually hold the other party back. So they
All
need to
right.
have a continuous support group between the husband and wife with regards to the child as a family.
Yeah.
And I always encourage, for them to have a family day. A family day,
Okay.
of course, with other children. Maybe, the sister, the elder brother, elder sister probably do not have any sort of special needs. But you need to equip the other siblings to understand, to accept, as well
Yeah.
as to embrace
Yeah.
their little brother or little sister, yeah,
Yeah.
in the family, and merge it as a family day. I put it as
Yeah.
a family day so that they could merge together, support each other, and feel attached. So to me, this would be really important, yeah. But
Yeah.
of course, they can have a session, family session, which I will have it also with them, without the patient, if I were to name it, to let them understand. Like, oh,
Yeah.
okay, Kaka, okay, what do you have? What do you understand about the current situation? How do you think things are similar or different?
Yeah.
Expose them with the accurate information, yeah, and make them understand. And how could they actually assist the little brother or the little sister who actually has
Yeah.
special need? Yeah, the
Yeah.
support group, the discussion within the family is very important. Or they probably would say, oh, my school actually laugh at me because they laugh because sister looks different. So how do we handle it? Because this is what we say, the associated stigma within the
Yeah.
family. So
Yeah.
we need to increase their understanding so that they could know how to attend to the friends, and they could, in fact, in a turn, educate their friends back. Yeah. So this is very
Yeah.
important. Otherwise, they will hold
Yep.
the hatred. Because of you, I got shamed in school. So we
Yeah.
need to
Yeah.
get this right. Otherwise, if it happens in the family, not to mention community, if there's already a stigma within the family, then things will be really difficult.
Yeah. Yeah.
Yeah.
Understood.
So, yeah. I'm not sure, but I saw some sort of a question at the bottom.
Yeah,
Is
that's right.
this?
Thank you, Doctor, for that earlier. We have we actually over the time, but we like to address. There's one question here, at least one. At least we address one question by Sharul
Yes,
Akmal
yes,
Muhammad Sharif.
yes.
Thank you for the input. Does MOE have any specific program to increase awareness about mental health, especially in school and higher learning institutions? He says it's never
Yes,
too
yes,
late, but
yes.
school is the best place to create awareness. Of course, yes. Comment from you, Doctor.
True. Yeah, Mr. Shahrukh, I totally agree with you that the school is the best place to create awareness, and the
Mm,
school is according to research, yeah, school is the safest environment, and school is the environment that is nearest to our children. Yeah, so that is definitely a best place for us to begin
mm,
and to
mm,
instill, as well
mm,
as to create more awareness and also providing help, outreach. Yeah, so definitely it's never too late. I totally agree with you. And of course, yes, MOE, there are many plans, module, programs, intervention in school. Even school counselors actually runs screening of the adolescents presenting symptoms. Yeah, and they do have session with the adolescents or school children who has any detected any sort of higher scores, yeah, or they might have group sessions with them. And there are also programs in learning institutions which addresses the need outreach programs. Yeah, we created webinars or also support group, even apps. Yeah, apps. Yeah, because university students probably, the younger generation would prefer apps. We have actually moved to the extent of creating program in apps for them to actually log in, for them to understand, or for them to seek help. Yeah, and
mm.
services programs has been provided, which I totally agree with you, Mr. Sharo. Programs are there, intervention has been done, initiatives are there, but probably we need a little bit of time to get to see the results. Probably it wouldn't happen in a day or two, but things has been done, and of course we are going to create more. I think the community, NGOs, everyone are trying to get this in hand and making it
Yeah,
better for
yeah,
everyone. Yeah, thank you so much for the question.
yeah. Thank you, Dr. Shah, for the response to that question. Yeah, thank you, Mr. Sharul Akmal Muhammad Sarip, for a very, very important question to need to be asked to
Agree,
understand the
agree.
ecosystem that we have currently and how we can improve on it. As I said earlier, Dr. Shaw, we well over time. I think our producer is giving signs that we are running
Oh
out of
dear.
time. But nevertheless, thank you. It has been a very great, it's an excellent setting session. Your sort of extent knowledge in this field needs to be, as and I hope we're doing it justice by creating this kind of sessions to encourage more participants and more awareness in the community, so that those affected, or families especially, families is important structure here that needs to be made aware of, especially if they have among members with such uh, mental illness, or learning disabilities. And I think we need to look at extending this kind of programs to go all layers of the community from B40 onward, especially among the V40 populations. Maybe the lack of awareness is in this group. We have those who came to seek for treatment or for consultation, are those who are already aware and they have the capacity to do so. But I think there is a need out there to reach out to the less wealthy group, for lower income group. And I think that's one of the efforts that Gibran had been trying to do by seeking assistance and sponsorship from various institutions and corporates as well, to help them make doing the outreach, to allow more participants, more take-ups from children from the B40 group. And maybe in your line of work, you may also find that children from this income level group have less capabilities or capacities to seek treatment, or to seek the right kind of education stream for them to go through. Um, yeah, I think I will end that session there. I would like to thank the organizers from myinsani.com and under the sponsorship of Digital Malaysia and the Telecom Malaysia Group. We wish to thank you, and also especially at Gibran Methode, Mustafa and teacher Rafiza for their relentless efforts all this while. And a special thank today for Dr. So Joanne for your superb sharing with us and very useful and beneficial knowledge. And I think this is part of what you're saying earlier, isn't it? We need to have more knowledge imparted in the community. Maybe final few words as a take home for us today, Dr. So.
Thank you so much, Mr. Rahmat. I would say that I think it is time for us to actually look into this matter seriously and play our role, yeah, as an individual, so that anyone who actually falls in this group will actually feels belong in the same community as us. Yeah, I felt that let us play our role
Yeah. Okay.
and
Thank you.
end this
That's yeah.
stigma. Yes.
Yeah, thank you. That's a very powerful, I think, statement to make. So let's all the community play our roles because we're all in this together. I guess
Yes.
it is part of how we sort of contribute to our community. And with that note, I'd like to officially thank you, Dr. So Joanne from University Technology Mara, for the contribution today and the session that's part of our series on by Gibran and developing unique potentials of every child that come to us. Again, thank you everybody, and all the good thing comes from Allah Subhanahu wa Taala. All the weaknesses and disruptions here is from our own weaknesses, and we wish to thank everyone who participated, everyone who asked questions. Apologies if some of the questions need to be answered, but if you stay on those pages, My Insani page, Gibran Visual Art Therapy, some of the YouTube channels, you can still write comments on them in your posting, and hopefully our administrators can respond to it in the future. Even if you're not on it now, you can still ask questions. And if Dr. So, if you probably browse through those posting, you might want to respond too, especially if it
Sure.
comes from this session. Yeah. So with
Sure.
that note, we thank you everyone, and well, I'll end this session with wabillahi taufiq wal hidayah. Assalamualaikum warahmatullahi wabarakatuh, and selamat sejahtera everybody. Thank you.
Thank you.